It gives me great pleasure to be here today to present the findings of the 2021 South African Child Gauge, which brought together over 90 contributors from around the country to focus attention on child and adolescent mental health and to draw on the latest available evidence to consider how to enhance policy and programming. The first chapter aimed to shift our perspectives and to present a holistic understanding of child and adolescent mental health. And one of the key considerations is this recognition that we are all moving back and forth along the mental health continuum, from feelings of well-being and thriving at the one end of the spectrum to significant and potentially disabling mental health conditions and disorders on the far right of the continuum. But to recognize that mental health and mental health problems affects us all. This focus on the broader continuum also encourages us to shift attention beyond a narrow focus on mental disorders in need of medical treatment, to recognize the need to intervene far earlier, to focus on prevention and to consider how can we help children thrive, including building young people's resilience and ability to meet life's challenges. And we drew quite strongly on the World Health Organization's definition of mental health, which has a strong emphasis on participation and agency. The third chapter focused on the environment and recognized that mental health is not just in your head, but shaped in powerful ways by our living conditions and primary relationships. It is therefore extremely worrying that 6 in 10 children in South Africa live in poverty, and 42% have been subject to physical or sexual violence. And these are data pre-COVID that don't even begin to consider the existential threats posed by climate change. It is therefore not surprising that 1 in 5 to 10 children in South Africa are struggling with a diagnosable and treatable mental disorder. And this chapter really focuses attention on the need for interventions that extend beyond medical treatment and the role of the health department to garner a whole of society response to address these broader social determinants of mental health, with a particular emphasis on addressing poverty, inequity, discrimination, and violence. The third chapter adopts a life course approach. And we know that early experiences and relationships, especially exposure to toxic stress and adverse childhood experiences, can have a lifelong impact on children's health and development, where both positive and negative experiences and exposures accumulate over time in ways that can become hardwired in the developing body and brain. For example, maternal depression is a key risk factor that impacts on responsive caregiving and attachment, so it is important to intervene early. But a child's trajectory is not written in stone. There is always opportunity to shift the balance, to promote mental health by strengthening protective factors, such as investment in positive parenting programs or anti-bullying or life skills programs in schools. What's also become clear is that investments in mental health need to be sustained across the life course to ensure that early gains are not eroded. And the chapter includes a specific focus on emotional regulation and executive function, with an emphasis on building children's capacity to cope with stress, plan ahead, and problem solve. All important considerations if we're thinking about resilience to climate breakdown. The following chapter focuses on the family as a foundation for child and adolescent mental health. It stresses that the influence of the family is not to do with family form and what the family looks like. Rather, it is the quality of the relationships within it that determine its impact on children's mental health. For example, protection from trauma, access to education, early learning and stimulation, and sensitive and responsive caregiving can build children's confidence and self-esteem. But we are also aware that families themselves are struggling. Poverty, unemployment, and rising food and fuel costs are placing increasing pressure on families and increasing the risk of conflict and violence within the home. So families too need support, and the chapter speaks to the evidence base and benefits of the child support grant and parenting programs, emphasizing that combined approaches that bring together both cash and care help to accelerate efforts and prove most effective. The following chapter focuses on the role of schools, which are a powerful platform for promoting children's mental health. And the chapter considers and emphasizes the full continuum from prevention through to treatment and recovery and reintegration of children who are struggling with mental health problems. There are many programs currently in place: care and support for teaching and learning, the National School Safety Framework, life skills education within the classroom, and access to school health services. But we also know that implementation and coordination, both within and between departments, is weak. There are also other priorities that need to be addressed. There's a call to invest in the mental health of teachers and to build their capacity to support learners' emotional well-being, to manage challenging behavior in the classroom, and to identify and refer and support those with mental health problems and mental disorders. And equally important, the need to support children across transitions, the transition from ECD programs to the first year of formal schooling and from junior school to high school. The next chapter focuses attention on the role of healthcare services and highlights the significant treatment gap, where only 1 in every 10 children with a mental disorder is able to access care. It describes the lapsed mental health policy, the concentration of services within urban centres, limited staff, child-centred spaces and training, and the need for leadership both at a district and provincial level. Key recommendations include the need for training, task sharing, and supervision to build the capacity of ordinary health workers at district level to identify children in need of treatment and referral. And equally important, mental health literacy to improve care-seeking behavior, building the capacity of teachers, ECD practitioners, and parents themselves so that they are better able to identify risk factors and access healthcare support. The following chapter focuses on children's mental health in the digital world, and it recognizes this as both a threat and an opportunity to support children's mental health and enable them to access resources. It is therefore really important to build the capacity of schools, parents, and children themselves to navigate this space safely, confidently, and with care and respect for themselves and others. We know that violence against children is pervasive in South Africa, and that the forms of violence shift across the life course, increasing the risk for post-traumatic stress disorder, depression, anxiety, and substance use disorders, and increasing the risk of further victimization or perpetration, helping to drive an intergenerational cycle of violence. We also know that there are strong intersections between violence against women and children, which often co-occur in the same households and share the same risk factors. So there's a strong call for an integrated response to service delivery, where we factor in and respond to the needs of children in domestic violence cases, and where we recognize that caregivers of children who have experienced violence and abuse are themselves likely to be re-traumatized by that experience. So a strong call for a trauma-informed approach to health, education, justice, and youth programming. The following chapter focuses on the connections between disability and mental health. It recognizes that children and families with disabilities are particularly prone to mental health problems. And this is linked to the difficulties they encounter in accessing healthcare, education, transport and other services, as well as significant stigma, bullying and discrimination, on top of the everyday demands of coping with an impairment. We also know that mental health problems and disorders can in and of themselves become disabling and impair children's functioning and participation in everyday life. This chapter therefore has a strong emphasis on addressing discrimination and exclusion and enhancing participation as a key to promoting children's mental health. And it calls for a twin-track approach. On the one hand, to empower young people with disabilities to participate in family, school and community life, including the use of assistive devices, and on the other hand, to mainstream disability, to challenge discriminatory attitudes and practices, and to create a more inclusive school and community and home environment, including the provision of reasonable accommodations. The final chapter calls for us to put children at the center of our efforts to build a caring society. And it calls for a whole of government, whole of society approach in order to build an ecosystem of support. So really important to think about the importance of addressing poverty and promoting food security as a key ingredient or foundation for mental health. The provision of healthcare services, including mental health care. The need for opportunities for early stimulation and learning across the life course, and the need for healthy relationships within both the home and school environment. And last but not least, opportunities to succeed, to ensure that children have hope, agency, participation, and pathways that enable them to realize their full potential. Over the past month, we have also partnered with UNICEF, RX Radio, a radio station by and for children at Red Cross Children's Hospital, and the Daily Maverick to drive an intergenerational conversation about child and adolescent mental health and to share the findings from the gauge with the young people themselves. So I'd really encourage you to access some of the resources on our website and our social media feed, and to sign the petition calling for greater investment in child and adolescent mental health services, and to share that petition with others who care about child and adolescent mental health. Thank you.